Hello everyone. Welcome to the podcast Spill the Health Real Talk Real Health. I'm Dinesha. So today we're going to have Dr. Shawn who's going to help us clear up all the common questions and also the myths around the thyroid health problem. So doctor, thank you for joining us today.
Thank you, Dinesha. Hi everyone, I'm Dr. Shawn from Beacon Hospital. I'm happy today to be here for my podcast to share about thyroid related issue.
Let's start with the basic question, Dr. Shawn. So the common question that usually we have about the thyroid, we were listening quite often the word, but people are really rare and understand what is it about. So can you just explain to us what does it mean that can affect the daily life of an individual?
Thyroid by itself is an organ of the body. This organ produces hormone and the hormones affect our daily metabolic activities. The hormone is too much, we call it hyperthyroid. And hyperthyroid, that means there are too much of hormone. Patient will feel restless, you feel hot, the appetite keep increasing, at the same time the body weight keep reducing. There's a sweaty palm, tremors. And where that is the hormone too little, is called hypothyroid. Because of metabolic activities very down, patient is very tired, always want to sleep and no appetite to eat. Even though like that, the body weight keep increasing. That's why it's affecting them in a lot of activities. Hyperthyroid patient, they want to be in aircon room, they don't want to go outdoors, they keep eating. Whereas hypothyroid patient, they prefer in a very hot environment, they don't want aircon, they don't want fan, and they always want to sleep. All these things affect their daily life.
Let's go for the next question, doctor. Usually a human get confused with anxiety and also the thyroid problem where they cannot clarify and differentiate with this. So can you just briefly explain on what is anxiety and how the anxiety can affect to the thyroid problem?
Actually, anxiety and I will say hyperthyroid is almost similar. The presenting symptom is similar, but the underlying cause is completely different. For hyperthyroid, because of the hormonal changes, the thyroid hormone are too much. That's why making patient present something like tremor, palpitation, heartbeat very fast, easily get angry, and they are sweaty palm, they have no patience, they always wanting to be fast. There are a lot of people that think like that. They might misinterpreting as patient get anger disorder, they get anxious, they got a lot of aggressive behavior. That's why they mistaken from all these psychological issue. Whereas anxiety disorder, anger, rushes, all these things, the presenting symptom almost similar, but the underlying cause is different. Anxiety means there's no physical problem, but the patient psychologically having problems. How to differentiate it? By one look, is not easy to differentiate. You need really a physical, need some doctors to see or need some experienced psychologists to see, then we can differentiate.
So the next question, which is quite commonly people will be mentioned to everyone, that they are burning out actually. So the burning out, is it something related to the thyroid problem as well, or else the thyroid hormone is affecting something related to the psychologically or physically, doctor?
Actually, this question is about similar to the just now the question. How a person present as burnout. They feel tired, they want to sleep, they have no energy to work, they like really nothing to look forward. That's why they feel very down, very depressed. This type of thing very similar to how a patient of hypothyroid, not enough thyroid hormone presenting as. The patient of hypothyroidism, they always want to sleep, they have no appetite to eat, they have no energy to work, they seems like loss of interest in life also. By one look, they are also very similar, but that's why they need somebody, some professional, a doctor, a psychologist to assess. Actually, the way of assess is very easy. A psychologist usually asks, oh, this might not be a psychological problem, to look for doctors. Just now, like the hypothyroid and anxiety is the same. When you look for doctors, we all always rule out pathological problem. By one blood test, the thyroid function test by itself, we will know whether it's hyperthyroid, hypo or hypothyroid. If not hyper, no hypo, it most probably will be the psychological issue.
I see. Usually an individual will get to know that they have the thyroid once they will go for the particular checkup only. But is there any possible sign or symptoms that can be an individual can understand without their realization that thyroid is started to causing to their body, doctor?
Actually, most of the patients found something wrong, only they go to check out. It's not like they check out suddenly find thyroid problems. It's the other way around. A lot of patients, actually most of the thyroid present as no hormonal issue. They just found a neck lump. When they found a neck lump, they feel discomfort. Then they look for doctors. So when come to doctors, clinically we will check whether the lump is due to a thyroid problem or not a thyroid problem. Then we will do an ultrasound to confirm whether the lump is from the thyroid or from the other things. When the lump is from thyroid, next thing we will do is do a blood test, do the thyroid function test to see whether patient is hyperthyroid or hypothyroid. Then from there we know how we go proceed for the next steps. Of course, there are the other group of patients, they present completely different. There are patients coming without a thyroid problem, without any neck lump. They will tell me, doctor, I keep losing weight, but my appetite increasing, I eat a lot. Why like this? When the patient mentioned this, we will ask more whether you are heat intolerant, your head, then we check whether the hand tremor or not. If female, we will ask whether how they are menses. If all these things affecting, changing, then most probably it's a thyroid problem. And a lot of doctors will be trained when we found this problem, automatically we do a thyroid function test first. And thyroid function test usually will tell us what is the problems. That's why a lot of patients, they present with something else, with the suspicious, we do the check. Only a handful of patients, they come for routine medical checkup, only we found out thyroid problems. Then we treat accordingly.
Is there anything else that we can relate them without checking before the early signs that we can judge that the person could have the thyroid problem, doctor? Maybe from the physical signs or anything?
Physical sign, always patient presenting with a neck lump as the earliest physical sign. But some patient, they didn't present a neck lump. The other group is present the eye protrusion. The eye be probe out, then usually patient won't notice. But the people around them will say, hey, your eye look a little bit out, what's the problem? And actually, quite interestingly, public, they already know it. The eye pop out, it could be thyroid problem. Then they will come to doctor, my eye pop out, it could be a thyroid problem or not. And that's how they come to see lah. But it's not all thyroid issue have this popping out eyes. Mostly they still come with the neck lump. It's the most common symptom they come. They feel something abnormal. Sometimes we cannot feel the lump, but the patient themselves, they feel something there. But whatever things, an ultrasound, you find out the issue.
I see. So, Dr. Shawn, would you like to explain about the hypo and hyperthyroidism, the difference between these two?
Hyperthyroidism, patient presenting with heat intolerance, increased appetite and lose weight. At the same time, they will feel hand tremor, hand sweaty, palpitation, heart rate very fast. Also, they have reduced menses, even no menses, and have diarrhea. For hypothyroid, there's completely opposite. Patient presenting with cold intolerant, they're afraid of cold, appetite reduced, but weight keep increasing. At the same time, they're always sleeping. Then you measure their heart rate, the heart rate is lower than normal. The skin texture become very coarse, the hair become brittle, easy to fall, like they are old, aging very fast. That is hypothyroidism. Biochemically, we check hyperthyroidism, the thyroid hormone is all high. But hypothyroidism, the hormone is all low. Of course, we have to know that there's the other group of patients, we call it normal thyroid function. We call it euthyroid. So they won't have symptom of hyperthyroid, they won't have symptom of hypothyroid. In fact, euthyroid patients is the most presenting group in the thyroid issue.
Doctor, what are the treatments that needed for this kind of thyroid person, or else when they get to know that they need a particular surgery process, they have to go the procedure?
For treatment wise, we can divide treatment into take medicine or do surgery. If patients have hyperthyroid, we will give medicine to suppress the hormone to make the hormone become normal. If patients is hypothyroid, then we can supply back the thyroid hormone to the patients so the hormone back to normal. Whereas if surgery in very certain condition only, I will say surgery in only 4 types of condition that need surgery. First group of patient that need surgery is cancer or suspecting cancer. When we suspect a patient has thyroid cancer or we confirm a patient has thyroid cancer, we need a surgery to remove the thyroid glands. Second group is thyroid nodule is too big until the patient feels discomfort or feel some compression. They feel difficulty in swallowing, difficulty in breathing, then yes, we need a surgery to remove the thyroid glands. And the third group will be hyperthyroid patient failed medical treatment. If medical treatment, the medicine that suppress thyroid hormone fail, the patient keep on have to long-term depend on the medication, then we need a surgery to remove the thyroid gland so that they no need to take the medications. And the last group I will say is a patient preference. Maybe the nodule didn't give problem, but the nodule is just too big, too ugly. Everybody say, hey, how come your nodule there? He or she feel discomfort, she requests the nodule to be removed, then we will do surgery. Only these four groups I will say surgery. For medicine, medical treatment, only hyperthyroid and hypothyroid need to be treated with medications.
Okay, Dr. Shun, let's wrap up the last questions to you. Is there any memorable cases or any special case that you encounter in your experience before this?
I have treated a lot of thyroid patients. Every patient are specials, but you want to share, I have a lady came in, they have no neck swelling, the neck is perfectly normal. She complained of difficulty breathing, difficulty swallowing. Just say she might think of my thyroid problem, want to check up. Ultrasound of the neck actually show normal. Then we did the thyroid function test, also normal. Then we did a CT scan. CT scan found the thyroid gland in the neck were normal, but there are a lot of extension of the thyroid gland into the thorax cavity, means into the chest. And the thyroid that grow into the chest are so big that compress the swallowing tube and compress the lung, making her difficult in swallowing and difficult in breathing. So in this case, she need a surgery, and this surgery is very huge. We have to open up the neck, cut through the neck, take out the neck thyroid gland, then we have to split the chest, like what we do a bypass surgery, open up the chest, see the thyroid glands in the chest, took out all the thyroid glands, and we close back the chest and close back the neck, everything. So it's like a diagnostic challenge, and also it's a challenging surgery to do.
Thank you so much for sharing your valuable insight, Dr. Shawn, and thank you for everyone listening to this podcast. This is Dinesha signing off. We will see you in the next episode. Spill the Hell, Real Talk, Real Health.